Our surgery day begins very early. We ask that our spay-neuter patients arrive at the hospital between 7:30 a.m. and 8:30 a.m. Upon checking in with our front desk, you and your pet will be taken into a private exam room where you will complete the pre-anesthetic form and discuss any questions or concerns you might have with a veterinary technician. Your technician will then escort your pet to our treatment area where she will wait until the doctor is ready for the pre-surgical exam. This is a thorough exam where the doctor will examine all aspects of your pet to make sure he or she is eligible for surgery. This includes looking at the eyes, mouth, and ears, as well as physically examining the body for abnormalities, taking a temperature, and listening to your pet's heart and lungs. The next step is to collect a blood sample from your pet. Just like your own doctor would require lab work prior to admitting you into surgery, we recommend blood work prior to any procedure that requires anesthesia so we can have a complete picture of your pet's health, inside and out. Blood work can tell us if your pet's liver and kidneys are functioning properly, which is important because they help filter out the anesthesia. Blood work can also alert us to anemia, an underlying infection, or a clotting problem. An IV catheter is then inserted and IV fluids administered throughout the day. Your pet is then allowed to rest in his or her cage for a few minutes. Fluids are an added safety measure for your pet during surgery. They help to keep your pet's blood pressure stable during anesthesia and help your pet's body clear the administered drugs from their system. In addition, the IV catheter provides easy access to a vein should an emergency occur during surgery. We then administer medications uniquely tailored to your pet's needs that will help them relax. Your pet is then allowed to rest for a few minutes while your technician prepares the induction area and the surgery suite. We are proud to offer you the latest technology through our cutting-edge laser. All of our spay and neuter surgeries are done with this laser, meaning less bleeding, less pain, and faster recovery for your pet. Your pet is moved to the induction area where they receive an injection to induce anesthesia. This makes them very sleepy. Your pet is then intubated with an endotracheal tube and connected to the anesthetic machine that administers oxygen and gas anesthetic. This gives us the ability to quickly adjust your pet's depth of sleep while under anesthesia. We also maintain controlled breathing for your pet. We continue to monitor your pet during surgery in a variety of ways. The doctor listens to the heart and checks your pet's pulse while the technician begins to shave and clean the surgical area. We also have a pulse oximeter and electrocardiogram machine that monitors the oxygen level of the blood and monitors the heart rhythm for arrhythmias or abnormalities. Everything is recorded in your pet's file for future reference and to adjust protocol if needed. This allows us to have a history of any reactions or abnormal responses for future anesthetic or surgical events. Your pet is then transferred to the surgery suite. Our private surgery suite is an isolated, sterile environment that features our cutting-edge laser, oxygen and anesthesia machine, pulse oximeter and electrocardiogram machine, and heated stainless steel surgical table. There is also a viewing window that allows owners to watch the surgery if they would like. We clean and sterilize the surgical suite and the doctor scrubs for surgery. We sterilize all of our surgical equipment, including the surgical gown our doctors wear, in an autoclave after every procedure. While the doctor is performing the surgical procedures, your pet is monitored by our surgical nurse for heart rate, respiration, gum color, and level of anesthesia. Your pet will also be on a continuous EKG and pulse oximeter monitor during anesthesia. Once surgery is complete, your pet is taken to recovery, where he or she is accompanied by a tech until fully awake. Your pet is then allowed to rest under the supervision of the doctor and technician while they call you to report how he or she did during surgery. Routine surgeries are typically released after 3 p.m. the same day. When you come to pick up, a technician will go over all home care instructions and medications and answer any additional questions you might have.